Thank you, Doctor, and good afternoon, everyone. As you just heard, the numbers are moving in the right direction, and we should feel good about that, but we also should be very aware of the strain that potentially could be coming our way, so that reinforces the need to be wearing our masks and following the protocols that are going to keep everybody safe. Our goal continues to be keeping people safe and out of the hospital, but we also are beginning to identify ways that we can provide our local businesses with incremental flexibility without increasing the infection rate, our hospitalization rate, or our mortality rate. You've seen the beginning of that incremental effort over the last week, and we expect that to continue in a way that keeps everyone safe. I want Rhode Islanders to know that our transition continues to be wholly focused on the COVID-19 response and vaccine rollout. We are working what seems to be around the clock. Our priority is getting shots into the arms as quickly and safely as possible. And our team continues to work closely with the state COVID response team, and I'm meeting with Dr. Alexander Scott and General Callahan every single day to ensure we're on track and that I have full understanding of what our team is doing in the state so we can hit the ground running day one when I become governor. Yesterday, Dr. Alexander Scott and the General joined me at a meeting of my transition COVID advisors, a team of national and local leaders who will advise me on my transition on the state's pandemic response and vaccine rollout, particularly as it relates to vaccine distribution and building capacity at the municipal level. It was a great, informative meeting. It was open to the media, and I thank everyone who is volunteering their time on that group of advisors to serve and to share their perspective and expertise with me. Yesterday, I was at another call on the White House with governors around the country to discuss the vaccine rollout. Connecting with and learning from our other states is critically important to me as we move forward. Over the weekend, I had the opportunity to tour operations in Central Falls, at Central Falls High School Vaccine Clinic with Mayor Maria Rivera, and I was impressed with the community engagement they've been able to build around their vaccination effort. So in the weeks ahead, I think what we're seeing that municipalities can and will play an instrumental role in getting as much vaccine shots into the arms of the people who live in our 39 cities and towns. Again, this week I convened 2 meetings with Dr. Nicole Alexander Scott, along with the team that's working with her and municipal leaders from across the state to discuss the vaccine rollout at the local level. Keeping the information and input flowing both ways between state and our municipalities, I believe, is a key and effective vaccine rollout strategy. This work will continue, and I will engage our municipal leaders in a way that shares their feedback and the state shares information that is critical to all 39 cities and towns, and asking their input to help us execute a plan that gets shots in arms as quickly and safely as possible.